fortnights ago, we talked about conflicts. And that was where we rounded up our discussion last week. We talked about the causes of conflicts. So today we want to start with strategies that can be applied in solving interpersonal conflicts. Strategies that we can apply in solving or managing interpersonal conflicts. Okay. Strategies that can be applied in managing interpersonal conflicts. Number one of these strategies is that we can deal with it. We can deal with it. We can deal with it. How do you deal with such, with conflicts? People may prefer to avoid conflicts, and this is never a good solution because it leads to feelings of regret and guilt. So if you guilt every time you have a conflict, you'll be quitting every job you ever have in a short period of time. So dealing with conflict is like you want to ignore or avoid it. You ignore or avoid it. So anytime it comes, you want to pretend as if it doesn't happen. You just remove your eyes as if it has not happened. So most times it leads to feeling of guilt and regret. When you learn to manage conflict effectively, you'll be happier and healthier, physically and emotionally. Okay? So dealing with it is like ignoring it or avoiding it. The number two way of managing interpersonal conflicts is that you have to think it through. Think it through. That is, you will think about it before taking a decision. You will think about it before taking a decision. So addressing the person with whom you have a conflict, you have to consider discussing the situation with a friend or family member. You want to plan your strategy, including what you want to say. So you have to think about it before taking a decision. The next one is you talk it out face to face. You talk it out face to face. That has to do with face to face communication. So that by the time you meet one on one, you'll be able to rule out some misunderstandings. So you want to set aside time to meet with the person face to face at a mutually convenient time and place. Okay? So you want to talk one on one to settle the problems that is within you, within the two of you, either between an organization and an individual. So you talk it out face to face. That will be a face to face communication. You talk one on one. I think I've mentioned about 3 now. Deal with it, you think it through, talk it out face to face. Number 4, you can use a mediator if necessary. Who is the mediator? Somebody that will stand in the gap for both of you. Somebody that will stand like an intermediary. A mediator. A mediator is somebody that can stand in between you and the person you are having conflict with. Okay? So you can decide to use a mediator if you like. Okay? Now the next one is apologize when appropriate. Apologize when appropriate. Apologize when appropriate. That one as it applies. Just go and give apology. I'm very sorry. Sorry for what I've done. It doesn't take time. Just telling somebody I'm sorry doesn't take time. Okay? I think number 6 points here. You work on your communication skills. You work on your communication skills. As healthcare managers, who wants to be dealing with the public or who wants to be dealing with people in the health clinics or health centers, you need to understand these skills very well, because there are conflicts. Most times conflicts come up between caregivers and the people you are caring for. Okay? So you need to understand all this. If you're having a conflict with your patient or your client, you are unlikely to get the good part of him or her. He may not want to open up to you because he couldn't believe in you. So it is the ability to express yourself clearly. You see, it is an ability to express yourself clearly, working on your communication skill. Now let's quickly go to prevention and management. That's chapter 5. Chapter 5. Prevention and management. That is chapter 5. Prevention and management of infection in healthcare setting. Prevention and management of infection in healthcare setting. So I want you to have this as a subheading under that chapter. Basic measures to prevent transmission of infectious disease. You see, basic measures to prevent transmission of diseases, infectious diseases. This is the subtopic under that chapter. The 2 basic measures. Number 1, we have standard precautions. All these topics are very, very important to you as healthcare workers, but these are your major areas which you cannot do without, even in exams. Standard precautions, and we have transmission-based precautions. Standard precaution, transmission-based precautions. Standard precaution is a primary strategy for minimizing the spread of infections in healthcare settings. Standard precaution is the primary strategy for minimizing the spread of infections in healthcare settings. Okay? And there are some practices that form part of standard precautions, which include hand hygiene, personal hygiene, personal protective equipment, aseptic technique, reprocessing of reusable instruments and equipment, disposal of sharps, safe handling of waste and lining. environmental controls, including cleaning and space management. But the most important thing there, which I want to really emphasize, is aseptic technique. You can also call it aseptic technique, but the correct pronunciation should be aseptic. You see, aseptic technique is a precautionary method used against any intending organisms. Precautionary methods used against any intending organisms. Those are aseptic technique. Okay, let's quickly go to transmission-based. Precautionary. Transmission-based precautions. These are precautionary methods applied for suspects. These are precautionary methods applied for suspects. Okay? It is in addition to standard precautions. You see, it is applied in addition to standard precaution. Just like we are having coronavirus of a thing now, there are standard precautions they're giving us, like hand washing and some other things like that. Wash your hands, make use of nose mask, use this, use that, use that. So when it comes to transmission-based precaution, this is where you want to begin to talk about isolation. You want to begin to talk about isolations because you don't want people to spread the disease. You need to understand this area very well. This is where isolation comes in. You see, standard precaution is when you get suspects, just the way they are getting them now. Isolation, when it gets to isolation, you are now going into transmission-based precaution. Okay, you need to cite these examples when you meet questions like this. Questions can come out in this form. You can be asked to explain the basic measures in preventing transmission of infectious diseases. You can just be asked to explain it, which means you are going to explain this too, and you give examples. You can be asked to define aseptic technique. You see, so you have to get used to all this. So it is an additional precaution to to standard precautions given. So transmission-based precaution is additionally applied precautions to standard precautions, which involves isolation. That is where you begin to wear gloves, wear all these things, gloves, disposable gowns, and all that needed to be put on. So you can be asked to explain those basic measures in preventing such things. Again, we want to quickly go into guidelines for disease control. Guidelines for disease control. You see, in this area, you can be asked to explain the WHO technical guidelines for disease control. You can be asked to explain the WHO technical guidelines for COVID-19. Questions can come up like that. Okay? Let me just read it from here as it is in the material. The development of technical guidelines is based on consultations with members of WHO expert advisory panel on trachoma and prevention of blindness, and with a network of 20 WHO collaborative centers around the world. When available, specific experience acquired in countries is taken into account. The WHO technical guidance focuses on public health problems. That is where I'm going. The WHO technical guidelines focuses on public health problems in terms of blinding diseases globally, and where there is potential for intervention, either for prevention of disease or its complications, or for restoring sight. Many of the technical guidelines are published in the non-serial WHO publications, which can be obtained through the online bookshop. Okay? So one of the technical guidelines now is strategies for the prevention of blindness in national programs. So if you are to look at it from the point of view of COVID-19, you want to look at the strategies for the prevention of COVID-19 globally. That is one of the strategies, one of the guidelines. They are coming up with a strategy for the prevention of COVID. Okay, so you need to look at that. It's going to focus on public health problems like COVID, you see, in terms of avoiding the spread. The guidelines will cover mode of spread, prevention, treatment, management, and control. Okay? So if questions like this is asked, because you may ask, explain the WHO technical guidelines for COVID-19. So these are some of the things you are going to look at. You see, it focuses on public health problems. You want to talk about the mode of spread. You want to talk about the way to prevent. You want to talk about the way out, the treatment, the control, the management. All right. So they only make use of trachoma here, but we are making use of COVID-19 as our own case study for now. This guide has been written for managers of national and district trachoma control programs. It sets out step by step. You must note all this, step by step, what is needed to assess the management and extent of the trachoma problem in the area, and how to plan, implement, monitor, and evaluate a program to control and ultimately eliminate trachoma. In your own case, you will use COVID-19. Okay? In your own case, you are using COVID-19. All right. So, in this place, they made use of diabetes as case studies, glaucoma, but I will not bother you on all these. Onchocerciasis, I'm concerned with COVID. So when you are asked to talk about or explain the WHO technical guidelines, you are going to talk about it in relation with COVID-19. You can also be asked, what are the strategies that are put in place for COVID-19? Strategies that are put in place for COVID-19. You may be asked that question. So you just have to prepare for it. Let's go straight to basic economies. That is chapter 6. You want to compare between basic economies and healthcare economies. Basic economies and healthcare economies. All right. Basic economies and healthcare economies. Upcoming. What's happening? Táyé wá bá mi wo kíní yìí. Bí ó ti kó wọn fún. Jẹ́ ká sáré wo dátà yẹn náà.
Ó kọ́ọ̀tù.
Ó kọ̀t.
Bọ́jẹ́ ti ṣe èyí tá a ṣe rà yìí.
Mi tí ì rà.
Ṣèbí ẹni kẹfẹ́ rà á lẹ̀ ni.
Jẹ́ sáré rà lẹ́ẹ̀kan gbà yẹn. Ṣùgbọ́n gbé gbogbo balance mi wá lẹ́ẹ̀kan. Nira náà bíbí. Jẹ́ sáré rà gbà yẹn. Wọ́n kàn ṣe gbogbo ẹ̀ ní àwọn. Weekly. Okay, ó ń lọ. Èmi mọ̀ ọ́n fi pé. Ó ń lọ, èmi ni mo kọ́kọ́ fi pé kò lọ. Kọ́kàn ṣó òfin mi báyìí.
Ìyẹn máa sọ lọ.
So, mo ti unmute tẹ́lẹ̀. Ṣó ilé.
Ṣèbí àwọn ló ń ṣó.
Okay. So, basic economics. Basic economics. So, basic economics is a citizen's guide to economics for those who want to understand how the economic works, but have no interest in jargon or equations. Very simple one I want you to understand is that basic economics is concerned with the allocation of resources among actors. Basic economics is concerned with the allocation of resources among actors. Okay? That is basic economics. It's the allocation of resources among actors. That's all I want you to understand here. And it deals with individual choice. Deals with individual choice. So healthcare economics is concerned with the allocation of resources within the healthcare setting. Healthcare economics is concerned with the allocation of resources within the healthcare setting. It's concerned with the allocation of resources within the healthcare setting. Okay. That is the only thing I want you to understand there. Just be able to differentiate between the two. Basic economics is concerned with the allocation of resources among actors. Okay? And it deals with individual choices. While healthcare economics is concerned with the allocation of resources within the healthcare setting. Okay, this is where they take decision on what to buy, on what to spend, on what to use. Okay, that is healthcare economics. Chapter 7 of this book want to look at strategic management of healthcare organizations. When we are talking about strategic management of healthcare organizations, you will need to think also about operation management in healthcare. You want to also talk about healthcare management. You want to talk about information management in healthcare. So strategic management of healthcare organization embraces these three factors that we're going to describe this morning. But before we go into these three factors that are embraced under the strategic management of healthcare organizations, let us first of all know the definition of strategic management of healthcare organization. All right. It is an essential guide. Strategic management of healthcare organizations is an essential guide for leading healthcare organizations through strategic management. Through strategic management. All right. Now, under this strategic management of healthcare organizations, we want to now begin to describe some three factors that must work under it. And these are operation management in healthcare. So if questions are asked in this way to explain strategic management of healthcare, you have to bring these three into it. What do we understand by operation management in healthcare? Operation management in healthcare. This one focuses on the practices designed to monitor and manage all of the processes within the production and distribution of products and services. It focuses on product creation and service development and efficiency. And it is essential for the efficient functionality and provision of health services, which includes controlling costs. Okay? So it focuses on product creation and service development and the efficiency. Focuses on product creation and services development and efficiency. Okay? That is operation management in healthcare. Second one is healthcare management. Healthcare management. This one is the administration or management of healthcare systems. See, it's the administration or management of healthcare system. Then information management in healthcare. Information management in healthcare. This has to do with the information applied to health and health services. It is a practice of acquiring, analyzing, and protecting digital and traditional medical information for providing quality patient care. It has to do with information management in healthcare settings. So you don't need to bother yourself, just understand it that way. It has to do with information management in healthcare settings. So when we are talking about controlling costs, cost control. What do we mean by cost? What do we mean by cost control? Cost control is a way of streamlining and creating necessary funding to maintain adequate levels and qualities of services offered. Cost control is a way of streamlining costs and to create necessary funding to maintain adequate levels and qualities of services offered. All right. There are some other things I want us to understand. Coming. Is time to work? Start me, Gary. So that is cost control. Definition for you. It's a way of streamlining costs and creating necessary funding to maintain adequate levels and quality of services offered. So there are some things I will still need to let you understand here when we get there now. Let's go into management accounting. Management accounting. This will be the last topic. We'll not be able to do this today. Let's round up here because we have just 6 minutes to go. We have just 6 minutes to go. So today we'll talk about strategies used in managing conflicts. We've talked about the basic measures in preventing transmission of diseases. We've talked about the guidelines for disease control. We've talked about basic economics, and we've talked about strategic management of healthcare. So we leave that last topic for next time that we'll meet. So I want to give room for questions because we have just 5 minutes to go. Question time. Hello.
Hello, sir. Good morning,
Yes.
sir. This
Good
is
morning.
Adigunye today from Ikeja Oshodi Center. I
All
want the
right.
definition of operation management in healthcare.
Okay.
I
If
can
you
get the
listen to me, if you listen to me very well,
Yes, sir.
healthcare management, information management, operation management, all of them falls under strategic management.
Yes,
So
sir.
where you are treating, if you are asked to explain strategic management of healthcare, apart from you defining strategic management, you have to also talk about these three. And
Yes,
I
sir.
said operation management has to do with the way you manage your services in healthcare.
Okay, sir.
The way you manage, and I said it focuses on product creation. It focuses on product creation and service development and efficiency. How you operate,
Hello, call my MTN. Call my MTN.
how you operate your health setting. You understand? That's an
Yes,
operation. Okay.
yes, sir.
Healthcare management,
Thank you, sir.
as you know, is the administration or management of healthcare systems. And
Yes, sir.
information management has to do with information management of information in the healthcare settings. I hope you understand now.
Yes, sir. Thank you, sir.
All right.
And this place settings of standard precautions. You said it involves
That is under
hand
basic.
hygiene, personal
That is under
hygiene,
basic. Don't
basic
mix
measure,
public health. Don't mix public health management with healthcare management.
basic measure to prevent
Under basic
transmission
measure
of
disease.
yes.
I told
You
you
said
that we have two precautions. We have
yes,
standard. Listen to me very well because of the time. We have standard precaution. We have transmission-based precautions. Standard precaution is a precautionary method against intending organisms. Okay, I said it's
yes,
a primary strategy for minimizing spread of disease. Okay, just like COVID. All right. So
you now said
precautions.
you said it
Precaution-based.
informs
What
you
we
said
are using presently in COVID-19 is standard precaution for people that are suspected.
yes,
Okay,
sir. Yes, sir.
people for COVID. The next thing is to isolate. When it gets to the level of isolation, you are talking about transmission-based precaution because
Yes,
you
sir.
don't want to get anybody. So transmission-based precaution is an additional precaution applied together with based. So you cannot practice transmission based without you practicing standard based. Okay?
Thank you, sir.
So
Yes, sir.
standard
But you
based
now
is
said
the primary
under
strategy.
standard precaution, you said it involves hand hygiene,
There is noise
personal
here.
hygiene.
Reduce your noise. Yes?
You said it involves hand hygiene, personal hygiene, aid septic technique. I didn't get the spelling. Is it aid?
Aseptic
AID?
technique.
Yeah, is it
Aseptic
aid?
technique.
Okay, sir.
ASEP. Septic. You just press septic.
Okay, thank you,
A
sir.
behind.
Thank you.
Aseptic.
Hello.
All right?
Yeah,
Hello.
thank you, sir.
All right.
Hello, sir. Thank you, sir.
Yes, we have just one
Hello,
question. Just go ahead with your question.
hello, sir.
Yes,
Good morning, sir.
go ahead.
My name is John Buga from Badagry Center.
Yes,
Hello,
go
sir.
ahead. Yes, Go ahead. Go ahead.
Hello, sir.
Yes.
I'm Ayomide from Abaronje Center. I want to ask the
Okay.
basic economics. Can you define it again, sir?
The basic what?
Economics. Can you define it again, sir?
So it's just two. I mean, basic economics, just understand it as the
Yes,
allocation of
I didn't
resources
get the definition. He
among
said
atoms.
it's concerned with the allocation of resources among. I don't
Atoms.
get the word.
Okay, let me re-explain it because we have very limited time. It is concerned with the allocation of resources among atoms. Okay,
Okay,
and
sir.
it has to do with individual
Hello,
choice.
sir.
Okay,
Okay, sir.
with individual choice. Why
Hello,
ethics
sir.
economics is concerned with the allocation of resources within the healthcare setting. All right,
Okay, sir.
go ahead with the
Follow me.
question.